the All Progressives Congress flag-bearer for the 2018 governorship election in Ekiti State, Dr. Kemi Adeosun has promised to prioritize restoring good governance in the state if he is elected. Dr. Fayemi, who governed Ekiti for one term before losing out to the incumbent Governor Ayo Fayose in the 2015 contest, emerged as the APC governorship candidate in yesterday's primary held in Ado-Ekiti, the state capital. He's also promised to make social investments in education, healthcare, and other social protection programs that reduce the cost of living, his key priorities. According to Dr. Fayemi, we have seen a cynical approach to politics that exploits the penury of the poor and the vulnerability of the marginalized. We have seen the entrenchment of the disdain for elders, traditional institutions, and all forms of constituted authorities. Instead of continuing the quest for freedom from ignorance, disease, and want, what we've seen is a paradigm that deepens captivity to these ills. The APC flag-bearer commended the National Working Committee for what he described as the free, fair, and transparent process that led to his emergence, saying it is a testament to the party's democratic credentials. He also appealed to his co-contestants in the primaries to put aside personal differences and work together for the success of the party in the upcoming general election. Meanwhile, President Muhammadu Buhari has commended the Minister of Mines and Steel Development, Dr. Kemi Adeosun, on his victory in the Ekiti State APC governorship primary election. The president offered his felicitations today in a series of tweets on his personal Twitter handle. President Buhari expressed optimism that having won the party's ticket, the former governor would leverage on his track record as a reformist with a passion for education, health and welfare to reclaim the governorship seat on July 14th. He also applauded the other aspirants, noting that the ruling party values internal democracy and described the success of the process as another testament to the APC's democratic credentials. He urged them to uphold the values and philosophy of the ruling party by coming together to support Dr. Fayemi in the forthcoming election in a bid to ensure the APC emerge victorious. The president also assured members of the party in Nigeria that the party would continue to work hard to lead the country to the next level in its development journey. Meanwhile, Ekiti State Governor Ayo Fayose is asking the APC governorship flag-bearer, Dr. Kemi Adeosun, not to celebrate yet, as it is not yet done and dusted. In a statement, Governor Fayose described Dr. Fayemi's victory at the rescheduled governorship primary of the party as a Pyrrhic victory and a prelude to a worse and more debilitating defeat than that of 2014. According to the governor, now I have been in power for more than 3 years and have served the people of Ekiti well. My legacy projects are there to speak for me and for my party, the PDP, as well as for our candidates in the July 14 governorship election, Professor Kolakpo Olushola Eleka. He also asked party members, he says, have been trampled by Dr. Fayemi, especially those who used to be members of the PDP to return home. According to Governor Fayose, Dr. Fayemi's victory has made the situation of the APC worse in the state. Away from politics, a strike action embarked upon by members of the Joint Health Sector Union, JOHISU, has entered another week with no signs of abating. Despite the threat of another Ebola invasion from the Democratic Republic of Congo and the crippling effect of the strike, the union insists that the federal government must meet its demands. In this next report, our correspondent, Olu Phillips, examines the issues and the implications of the prolonged industrial action.
Whenever you hear that song, it's always been an indication of brewing disagreement between two parties, mostly unions versus government. In the last 3 weeks, the health sector has been thrown into another season of suspended services, What was initially limited to the tertiary health institutions assumed a nationwide scale by midweek. Since the strike was called out by the leadership of the Joint Health Sector Workers JHESU, 3 meetings have been held with the federal government. First on April the 26th, 2018, then 2nd of May 2018, and the third one on May 7th, 2018, without any amicable resolution. So, what is it this time? Simply put, the health workers are asking for an upward adjustment of their take-home pay in line with agreements reached with the federal government some 7 months ago. The resolutions to all this appear to hang in the balance, while the consequences loom. First off, this is not a time to have a loved one who requires medical attention in public health institutions, as they may not get any service. Second, over the week, news of an Ebola scare filtered in from Democratic Republic of Congo, increasing awareness of a scaled-up surveillance in Nigeria. Despite the toll the strike is already taken, the Minister of Health and President of Nigeria Medical Association do not seem to agree with the idea behind the demands of JHESU members.
When you look at the two scales, what JHESU is asking for is to say, look, whatever is there, we want to have it on the CONHED scale. And we said no.
When you say JHESU, it means Joint Health Sector Union. It's an illegal body. We are not saying we are excluded, and that's what makes it illegal. But they are full of envy, rivalry, and lies.
Interestingly, the Minister of Health is a medical doctor. So are the Minister of State for Health and the Minister of Labour and Employment, who have attempted some mediation. So, is this difficulty in finding a common ground all about professional rivalry? 5 registered unions make up JHESU except the medical doctors. The striking health workers say they are resolute. The federal government seems to have other ideas to resolving the crisis, even if it's not what is being anticipated by the health workers. The medical doctors have also subtly threatened to embark on a work to rule if government heeds to JHESU. The crisis looks complicated, but sadly, it is the patients that are worse off. Olu Phillips, Channels Television News.
And taking a closer look at the issues is Channels TV's data analyst Babajide Ogusowo. Babajide, great to see you again. I see you came with no paraphernalia or anything like that, so I guess it's serious business then.
No, it is very serious. In fact, we probably could say this discussion should be rated R.
Wow. So the many stakeholders, major stakeholders, seem to be playing hardball on the ongoing strike. I mean, the federal government is not moving ground. And then you heard some of the doctors saying that JHESU is an illegal body and so on. So are those strikes effective at all?
You know, we've been having strikes for over 5.5 decades, and that's what the history tells us, from 1963. But we should ask ourselves, even when the strikes and all the agitation was going on back then, how much was allocated? How much did the federal government spend on health? And I'll reveal that to you, and I think it will surprise you. But today, the fact is, there are only 3 options to resolving all of this. The first is negotiation. The second is compromise. And the third is reaching an agreement. And in reaching an agreement, again, these parties, either they're illegal or legal, should look for a win-win solution, rather than look for a party to lose and some other party should win. Again, it is negotiation, compromise, and agreement, because these discussions and these agitations for better welfare, either for the unions or better welfare for patients, has always been around. Again, one of the reasons why we're having so much conflict in the health sector is if we look at the doctor-to-patient ratio, Amara. In the UK and US, for every 500 patients, we've got 1 doctor. In Nigeria, for every 6,000 patients, we've got only 1 doctor. So there's a lot of conflict, there's a lot of war going on in the health sector.
Yeah, and it's even made worse by the fact that doctors are leaving the country, which makes it even fewer in the country. But, you know, these steps that you mentioned have already been used before. The negotiation the conflict resolution, the agreements and all that. They have used that before. In the end, public hospitals are not running optimally, and you measure the quality of life by, the quality of healthcare a nation has. So what does that say about our own country? What are health indicators saying about us?
No, there are several health indicators, but what I've done is to bring out a list of 7 that we need to closely examine. Let's take the first, which is we have evidence today that 1 out of 11 Nigerians is suffering from diabetes. That is a statement of fact. We also have evidence today that 72,000 Nigerians die every year from cancer. That is approximately 8 Nigerians dying every hour. In simple terms, Amara, in the 1 hour that you'll be reading the news tonight, 8 Nigerians will have died of cancer. Again, we have evidence on waterborne diseases that kill children. The evidence shows that every hour, in the 1 hour you'll be reading the news tonight, 15 children will have died due to waterborne diseases. Again, we have evidence on malaria. Malaria killing over 20 Nigerians every hour. So all these indicators clearly show we've got a big problem. All these indicators show, let's look at HIV. HIV as well, based on UN estimates, approximately up to 200,000 people in Nigeria die of HIV-related causes. And more importantly, or most importantly, if you look at under 5 deaths, that is where the challenge is. A lot of children are not even growing to see their 50-year-old birthday. In simple terms, Amara, only 1 in 8 children born in Nigeria live to see their 50-year-old birthday. And so in the UK, when children are celebrating their 50-year-old birthday, a lot of Nigerian parents are celebrating with death certificates.
That's a very grim figure. So you have just reeled out, Babajide, enough to make one sit and think.
Oh, clearly, those are the challenges we face today. We need to focus on our health indicators and focus less on the strikes. We need to look at our hospitals. We've got less than 5 hospitals that have the radiotherapy equipment that help patients with cancer. Only 5, less than 5 hospitals have those equipment. So rather than focus on the striking unions, we need to focus on improving the standard and quality of young Nigerians. Okay. Young Nigerians are dying, and older Nigerians are dying. And more than these health indicators, in the final analysis, we need to have a healthier attitude and approach to all what is going on.
Thanks a lot for joining us on the News at 10, Babajide.